It's such an incredible honor. It's so amazing really to be here in front of you as your Chief Nursing Officer, to have the opportunity to speak with you this morning, to share the vision of 1,735 nurses here at Children's National, to see how nurses are transforming care every day, to consider the opportunities and challenges before us, and to imagine what our story will be as we move forward. So stop and think with me for a minute, right here and in this very moment, while we're gathered here this morning. A nurse helps to prepare a patient for surgery. A nurse comforts a family who's received a concerning diagnosis about their child. A nurse is on a helicopter transporting a patient here to our facility. A nurse is hanging a cocktail of medications, hoping and praying that it delivers the cure that her patient desperately needs. A nurse responds to a child in cardiac arrest. A nurse in the ambulatory setting provides health and wellness training to a teenage mom. And a nurse practitioner is rounding on her patients. This is the art and the science of nursing. The art of nursing speaks to the caring, the compassion, the empathy, the listening, consoling, and the celebrating that we engage in with our patients and families every day. The science of nursing emphasizes the evidence and the knowledge, the best practices, research, and education that drive our clinical practice at the bedside. It's the art and the science of nursing that are fundamentally tied to one another. Practiced together, they define the professional practice of nursing. So here's my story, and Kathy summarized a little bit of it for you earlier. I came to Children's in 1988. I was a new nurse grad. I worked as a direct care nurse in the NICU for 8 years at the bedside. I was a little bit surprised that I landed here. I thought for sure that I was going to be a gerontology nurse, so I guess it's no surprise, kind of both opposite ends of the life spectrum. I loved taking care of the preemies, and I was amazed at the difference that I could make in these babies' lives and at the beginning of their lifetime. In 1996, I joined our care coordination team, helping families in the NICU as they prepared for their transition to home. And I worked as a clinical coordinator before becoming the manager in the NICU for 8 years. I stepped away from operations in 2007. I partnered with Brian Jacobs, who was at that time our new Chief Medical Information Officer, and together we led the implementation of technologies related to the new East Inpatient Tower opening and the implementation of CTI Phase 2. Afterwards, I came back into a nursing leadership position in clinical operations and assumed the position of Chief Nursing Officer in July of this year. So I've been asked many times over the past 25 years why I've chosen to stay at Children's National Medical Center. And here's what I've learned. I love the singular focus on pediatrics. Children supports an environment where collaboration is the norm, it's the expectation. It's a place where we can learn and grow. It's a place where there's a profound commitment to the professional practice of nursing. Our stories here save lifetimes, and nursing has a vision that's bold and confident. Our nursing vision statement was developed several years ago by our staff nurses. It describes who we are, and it invites us to dream about who we might want to become. Whereas our current vision statement provides a strong foundation, our future is going to look a little bit different than the past. Therefore, we will revisit this vision statement. In January, we'll kick off a group of staff nurses, and we'll reconsider the vision statement as it currently exists and how it might look a little bit different as we move into the future. It's part of our process as we begin to think about magnet redesignation in 2014. And I think it would be reasonable to expect that we'll see some new words that kind of lift up the value of nursing, perhaps put a stronger emphasis on the business acumen piece, really looking again at transformational leadership and how we will be leading change. Our vision statement has provided a roadmap for us as we consider our current priorities. So here are some priorities that I've identified in my position as Chief Nursing Officer. Continuing education and professional development, employee engagement and RN satisfaction, recruitment and retention and workforce outcomes, full integration of the advanced practice provider in our care delivery model, quality and safety, service excellence in the patient experience, financial stability, really being able to demonstrate the value of nursing, magnet redesignation, And then aligning the work of nursing with our organizational priorities. Nursing will lead in Transformation 2018. Nursing will lead in lean methodologies. They've already kicked off and led in a very collaborative way at least 2 of our value stream analyses associated with our lean rollout. And nursing will lead within the Bear Institute. Certainly, an overarching priority there is really under the umbrella of healthcare reform and deciding how nurses will deliver better care, how we're going to measure the impact of nursing care at the bedside, and all the while doing so in a way that's cost efficient and really kind of understanding what it means to balance expense with the value of nursing. So how do we get there? In 2010, the IOM chartered a group to really look at and to guide us, provide some guiding principles around what the future of nursing was going to look like. And out of that work, they developed 4 key messages, if you will. They focused on the need to transform leadership, the need to transform our practice, the need to transform education, and then the need for better data on healthcare, on our healthcare workforce. So if we look at key message number 1 around transforming practice, let's consider just for a moment how we're living currently in our current environment within the need to transform practice. In 2009, we established the director of the advanced practice nursing, and in that time, we've almost doubled, we've actually more than doubled the number of advanced practice nurses here at Children's National. And in 2012, Kathy Sheehy, one of our advanced practice nurses, was recognized as our Magnet Nurse of the Year. We held our first annual Children's National Advanced Practice Nurse Conference. 18 nurses graduated recently from our first Children's National Faith Community-based certification program. We hosted and participated in the Pediatric Registered Nurse Exchange Program, hosted the American Nurse Project, where 4 of our own nurses were highlighted for Nurse Week celebration in 2013. Nurse leaders participate in lifelong learning development and in leadership and learning programs. And nurses as teachers, this is really about reconceptualizing our role and being fully actualized in all aspects of our role as nursing. And some exemplars are in the NICU and in HEMON, where they've really championed projects around parent teaching and have been able to present at a national level and have had a podium to demonstrate how we're leading as nurse educators in pediatrics. Key message number 2 really speaks to the need to transform education and training through an improved educational system. So here at Children's, 78% of our nurses are BSN, 44 are master's prepared, 1% have their doctorate degrees, and currently many are actively enrolled in BSN programs, graduate programs, and doctorate programming through our Central Nursing Orientation Program. We have, and on average, 40% of our nurses are professionally certified. In the PICU and in the NICU, greater than 80% of our nurses are prepared at the BSN level or higher. And on 6 East North, 97% of our nurses are prepared at the BSN level or higher. When you look at key message number 3, where we really drove down on the need to transform leadership, and this really, in this recommendation, they really talk about collaboration across all disciplines to advance problem solving in healthcare. This lives in a very, very real and vibrant way in our environment today. Here are some examples. In the Heart Institute, as we reignited the heart transplant program and started the VAD program, nurses came to the table with their colleagues and recreated or created roles specific to these program rollouts, looking at the need and recognizing the need for content specialists and continuity of care nurses who could really partner again with their physicians in the rollout of these programs. Nurses leading and being recognized for the 2nd year in a row at the Magnet Conference this year, Elizabeth Bradshaw, for her collaborative work through the Heart Institute implementing pulse ox screening for newborns with congenital heart disease. Our Washingtonian Nursing Excellence Award winners this year, 2 out of 10 that were recognized across the region. Christy Baxter, who works in the Sheikh Zayed Institute for Pain Medicine, and Lindsay Kennedy, who's a nurse working in hematology oncology. and of course our very own Debbie Freiberg, who was recently recognized for her 35 years of service as a pediatric hematology oncology nurse.
For all of that.
We should thank her. So really, I think we are the future of nursing, and yet there remains a lot of work for us to do here. Our vision statement, I just would ask that we look at it again together. I think it's really not the answer, but a question for us to consider together. How will we lead in times of change? How are we going to help to transform care? Come and think and work together. We together will create our story. So as we consider the opportunities and the realities of the current healthcare environment, we can imagine that nursing will have increasing impact on primary care coordination, transitional care, and patient and consumer education, thus allowing nurses to practice to their full scope in more efficient and effective ways. The new healthcare paradigm is not going to change nursing. Rather, it's going to create opportunities for nursing to be more fully actualized in our practice. We can anticipate a shift from being disease-focused to being more focused on innovative ways to redesign how we deliver care. We can rely increasingly on the power of collaboration to advance problem solving, becoming more confident in each other's expertise, knowing the team, their individual roles, and discovering how to use each one of us to enhance the patient experience. The potential here is huge. Improved access really is a good thing. It means that more patients will be seeking our care. Therefore, our capacity to improve health is enormous. Nursing will educate patients and the public on how to leverage the current reality for the best possible outcomes. And nursing will make a difference. With millions more seeking health care. In pediatrics, we can expect more patients in primary care, more opportunities to educate the public at the point of care, more encounters to influence the behaviors that predict health and well-being. I believe in the value of nursing, and I believe nursing will continue to transform the patient experience. I believe that nursing will lead clinical care redesign, seeking new ways to measure and demonstrate the value of nursing, bringing innovative solutions to existing issues through the use of lean methodologies, and leading the implementation of new technologies through design of solutions that enhance decision-making at bedside. So what's your role? How can you help? Remain focused, be engaged, bring every part of your being to your work. Be present. Remember why you became a nurse. Be confident, composed, and bold in your approach. Commit to lifelong learning. Seek opportunities, get involved, and speak up. Be accountable for your practice. Your patients rely on your vigilance. Practice the art and the science of nursing, respond to the human aspects of health and illness to foster healing, and demonstrate your expertise, your competence, and your critical thinking as you engage in the nursing process. Be in the moment. Take pride in your work. Appreciate your coworkers and your colleagues. Take care of yourself. Make a difference. And while we've been here this morning, think again. A nurse scientist ask a question that will change the way that we care for kids. A new nurse makes a good catch. A nurse provides palliative care for a patient nearing the end of their life. A nurse teaches a new mom how to breastfeed her premature infant for the first time. A nurse educates a family who's preparing to go home. And a school nurse is attending to a newly diagnosed diabetic and his insulin needs. Your story will begin a legacy. How will you make a difference? What will our story be?